Now then, I'm often asked about the incidence of plagiocephaly, brachycephaly or flathead syndrome. Current thoughts are that as many as 1 in 4 babies have a slight misshapenness of the head. Sometimes it's at the back of the head on the side, sometimes it's actually right at the back. One is called plagiocephaly, one is called brachycephaly, but nevertheless about 1 in 4 babies are thought to have a slight misshapenness in varying degrees, whether it be moderate, mild or severe. Now, for purposes of the filming, obviously we're using Oliver, who is actually moderate to severe, and in fact Oliver himself has had some helmet therapy, and that has actually improved considerably, but you can still see the asymmetry in the child's skull. The other interesting thing to note is that, have you noticed how Oliver isn't particularly good at supporting his own weight? And this is a condition called hypotonia. That means lack of tone of the postural muscles. There has been some talk about a link between plagiocephalics, children with flathead syndrome, and delayed muscle tone or hypotonia. Now, Oliver certainly is at the age now where he should be sitting up and supporting himself quite happily and crawling around, but as you can see, I'm having to support Oliver at the moment. The other thing that I have noticed myself, although I don't believe any research has been done, is that because of the shape of the skull, it would make sense that the eye development has got certain adaptations to overcome. For example, if one side of the one orbit is a lot closer to the brain than the other, then the pathway of the optic nerve has got to be slightly stretched on one side and the other. And I also suspect that some of the musculature may be slightly weaker on one side than the other, and I've certainly noticed that in my own patients, but I look forward to hearing some further results of any research that's going on at the moment. So, linked with hypotonia, possible links with visual difficulties in babies with plagiocephaly.